Welcome to the concurrent session, Cultivating the Community, Planting Seeds of Hope. I'm Beth Barry, the Senior Program Manager for the Alliance for a Healthier Generation Healthy Schools program. Healthier Generation uses an evidence-based approach aligned with the whole school, whole community, whole child model to work with over 1,000 South Carolina schools to support healthy eating, physical activity, and emotional resilience for students, staff, and families. During this session, you will gain a better understanding of the power of partnerships and community engagement to address social determinants of health and health literacy. You'll learn how to use the National School Wellness Model to showcase public-private partnerships and about methods to facilitate a better connection with parents, communities, and schools to improve wellness of children. Today's speakers are Regina Neesmith-Demery and Quinn Tasha Knox from the South Carolina Department of Health and Environmental Control, and Alexis Pipkin Sr. from Lee County First Steps. I hope you enjoy learning more about Lee County Leadership Interagency Coalition's Project CARE.
Good afternoon, everyone. My name is Regina Neesmith-Demery, and I am a health educator with the Department of Health and Environmental Control, DHEC. I am a health educator who has been in the fields for about 28 years, and I work in the area of community systems development, and I also am a part of 3 communities or 3 counties in South Carolina, which I work, Florence, Lee, and Williamsburg counties. I want to also introduce to you my colleagues that are with me this afternoon for this presentation. Elder Alexis D. Pipkin Sr., who is the Executive Director of Lee County First Steps, along with Quintasha Knox, who is also the Policy Systems and Environmental Change Coordinator for the Department of Health and Environmental Control. Our session this afternoon is Cultivating the Community, Planting Seeds of Hope. And as our introduction stated, that we are helping our community to understand the power of partnerships and community engagement. And we also, through this particular session, want to look at health disparities, look at the social determinants of health and how health literacy is used to improve community health. We also want to utilize a national school wellness model to look at how private and public partnerships can create or determine those things that that schools are in need of in terms of resources and to meet those priorities of our children. And we also want to discuss methods of better connection with our parents, community, and schools to improve academic success of our children. Next slide. So to give you a little bit of background, I want to go through this experience that we are about to talk about today as a gardening experience. And we know that this is the time of year when a lot of us want to do a lot of planting and get our gardens together. But it's a lot of work that goes into a garden. When you see beautiful flowers or nice fresh vegetables, we know that a lot of work and time went into developing a garden. So we want to compare our experience in community development and community engagement and also coalition development as an experience of gardening. We want to look at choosing the right spot. We want to look at designing a plan because that's essential, that whenever you're developing a garden, that you have to have a plan. Looking at the workers who are going to be essential in helping to get your garden together. Selecting the right seeds, prepping the soil, doing the planting, the growth, and also looking at perennials that are going to be coming back time after time, as well as the harvest. That's something that we look forward to in the near future. Next slide. So just to give you a little bit of background on what we have done in Lee County, the Lee County Rural Leadership Interagency Coalition was developed in about 2016. And it came together as a merger of two existing coalitions or councils that had been working in Lee County for a number of years. The Rural Leadership Institute, who was directed by the late Dr. Fred Shaheen, members of Lee County community had gone through the Institute and were working on some leadership projects and to also address some of the social determinants of health that were going on in Lee County at that time. And also there was an existing group, which was the Interagency Coalition, who were doing some similar types of projects and work. But the meeting of the minds came together in about 2016 because at this point, we wanted to look at maximizing what we were doing in terms of partnership and how we were going to further develop the communities in Lee County. So with this being, there was a transitioning period, but certainly we wanted to make sure that we made a greater impact in our community as a coalition. So as a stronghold, our coalition went on in about 2017 to apply for, at that time, was the Blueprint for Health grant through the South Carolina Office of Rural Health. And that at that particular point in time, I think that we were ready because we were a new coalition. We wanted to make a great impact in our community, but we also wanted something that would help us to catalyze or catapult our progress working in this area. So we actually received the grant in later 2017, and we worked to create a program called Project CARE, Community Advocates for Resources and Education. And that project was implemented in about 2018. Next slide. So as any good garden being developed, we had to design our plan. And we were so fortunate that the South Carolina Office of Rural Health had offered us this opportunity to look at the social determinants of health because Lee County at that time was having a lot of poor health outcomes. And we wanted to look at community development in terms of engaging this multi-sector group of organizations and agencies. But we wanted to kind of channel our efforts back into a way which we were going to be more impactful. So through training and technical assistance, we looked at building and enhancing our local leadership teams. We also looked at developing and implementing community projects that focused on the social determinants of health, but also supporting the creation of the blueprint or a plan that was going to help us to address some of the needs in this community. And we would like to take this opportunity, if I may, to thank Andrew Chandler and Darlene Lynch and others that have helped us along the way in terms of designing this effort in Lee County. Next slide. So we looked at we did a soil analysis, and any time you do a garden, a soil analysis is very essential because you need to know what you're working with. You know, what do you need to fertilize this garden? What do you need to take it to make it grow? And you really need to understand what you're working with in order to adjust and make those adjustments and find the right things that will help out your garden. So we looked at the health of this community, and we saw that there was a lot of problems in Lee County. We had about 22% of the residents were considered as food insecure at the time, and about 14% of the county was looked upon as a food desert. We had about 14% of people in Lee County that were living with diabetes. Breast cancer was the leading cause of death in women in Lee County, and also our Medicare population, 69% of them were hypertensive. In about 2016, when I was working with the coalition, it was ranked fourth in the nation. The county of Lee was ranked fourth in the nation for obese adults. So we had a lot of issues that we were working with. Also, poverty of children, about 37% of children in Lee County were living in poverty. And of course, Lee is a rural community, and about 72% of the county is classified or designated as rural. So we were challenged with a lot of things. And also, oftentimes when we looked at the county health rankings, Lee County was one of those 5 counties that kind of teeter-tottered from the bottom section for health outcomes and health factors. So we had a lot of work to do because there was a lot of issues in Lee County that we wanted to address, but we knew that through this coalition, we would be able to be more impactful in our efforts to actually impact those things. Next slide. So as we went through the process of working with the South Carolina Office of Rural Health, one of the things that we looked at as far as our social determinants of health, something that really stuck out as a sore thumb to us was the issue of education. We looked at economic development, we looked at some other issues that were going on at the time, but education seemed to be what we really needed to focus on as a coalition and as a community. And this particular slide that I have in front of you is that the second grade students on track for English language arts in 2017 to 2018, we can see that Lee County was, not doing so well at that time. Some schools in Lee County were pretty much in dire need of some assistance. So we focused on one particular school, which was Wesley Elementary School. And also we looked at the physical well-being of the children at that school. So we knew that about 9% of the children were reading on their grade level coming out of second grade. But not only that, about 31% of the children's physical well-being was not being met. So we just basically looked at a lot of efforts that we could possibly work into in terms of educational needs, but what other needs did the children have at that time? Next slide. So as we looked at our approach, we looked at a leadership group that was going to be essential in helping us to get the work done. And as any garden, you have to have the right types of workers. And our workers, or our leadership group, came from a diverse group of experienced people, some of them with lived experience. Some of them had worked on coalitions for a long time, but we wanted the right combination of people in order for us to be effective in what we were doing. So the names that you see on the screen and also the organizations that they represent were very essential in helping us to do the work that we needed to get done to address an important issue in this particular community. Next slide. So as any task of any gardens, you will need to select your seeds. So what are we going to do in terms of working with education? How are we going to impact the students' academic progress of this particular school in a rural community? So selecting the seeds was very important for us, looking at the parks, looking at playgrounds, walkability. What did the resources say in this community that this actual school or this actual community needed? We looked at education, literacy, early childhood education, access to, health opportunities, what type of community engagement we needed from other partners in this community to try to focus on the challenges that were needing to be met with the educational system. Also looking at healthcare providers that you know, there's so many challenges that we had here as a community. We needed to make sure that we were selecting the right seeds in order to make everything work. Next slide. And also, when we selected the seeds, we wanted to make sure that we were rooted and grounded. And everybody who knows about plants knows that the stronger the root, the sturdier the plant is going to be. So we wanted to make sure that we looked at evidence-based strategies going in that would be sustainable. We didn't want to just come in, do something, and just go away, but we wanted to come in and be impactful, not for that particular year, but for years to come. So we looked at policy, systems, and environmental change approaches that we could use that would certainly create those roots that we were looking for to engage the community as well as all of the leadership to make sure that we were doing our efforts and they were going to be long lasting and successful. Next slide. We also wanted to link what we were doing on the local level to our state health improvement plan, because it's essential that if our state health improvement plan, if we're going to meet the objectives of that plan, that we had to link what we were doing in terms of our activities back to the state health improvement plan. So we looked at priorities 1 and 2 of the state health improvement plan: resilient children through safe and supportive environments. We also looked at chronic health conditions, promoting healthy lifestyles and environments that prevent chronic conditions. And also we wanted to address things from the Rural Health Action Plan, because the South Carolina Office of Rural Health had developed the Rural Health Action Plan. And in order for us to make sure that we linked up with the Rural Health Action Plan with our local implementation strategies, we wanted to look at what the recommendations were from the Rural Health Action Plan. So we looked at access to health services, leadership development, leveraging and aligning funding, and also looking at ways that we could do coordinated school health through advisory councils or committees. Now I'm going to hand it off to Elder Alexis D. Pipkin Sr., and he will talk a little bit about prepping the soil.
What it used to be, so much more in poverty. Wake up all the teachers, stop the teaching way. Maybe there's them listen to what you have to say. Planting the garden, prepping the soil, so that they will listen to what we have to say. As Mrs. Neesmith Demery has stated, and as our partner, Ms. Knox, will also bring to the table, we had to look at ways for our collaboration to prep the soil to ensure that the work and the desires in terms of the social health determinants would be addressed. So we identified a method in which we could collaborate and develop relationships within our community, which is indeed a strong community. And we came up with a program that is called the Parent Cafe. And what a beautiful piece the Parent Cafe does, and specifically what the Parent Cafe has done for us, it has provided us the opportunity to create lasting relationships. Also, it has provided us the opportunity to empower our community, because the Parent Cafes provide conversations or to provide families the opportunity for physical and emotional safe spaces where the parents as well as the caregivers can talk about challenges and victories in terms of raising and developing their children. And the Parent Cafes specifically, they are structured with discussions that the families use the principles of adult learning principles as well as family supporting. And it is not therapeutic, but it is not a therapy session. It is an opportunity to create a safe space for our parents and our families. Participants leave the parent cafes feeling inspired, energized, and excited to put into practice what they've learned. In terms of planning the garden, am I moving too fast? I think I may be moving fast. Planning the garden in our families from the parent cafes, the 5 protected factors are essential that we want to make certain that our families would continue even after they've attended a series of parent cafes, because the parent cafes provide the opportunity for the families to come for maybe 3 sessions to discuss one of the issues around a specific parent, a specific protective factor. And as you can see, that's presented before you, the 5 protective factors, to those of you who may not be familiar with the 5 protective factors, are resilience. And that's simply parents are able to bounce back from situations and circumstances in life. And as we all know, with this experience that we currently have, we never saw before to live during a pandemic, and the world has changed. And at some point, we want to go back to some sort of normalcy or some sort of being able to adjust. And that's resilient, being able to help parents to have those types of skills. And as the data was previously presented to us, we want families and parents to have healthy choices and healthy lifestyle decision-making skills, relationships, positive social connections, being able to connect with people. And as I said, even when you look at this time, when people are having stressors in life, they need positive connections. And lots of times, some families experience a lot of negative connections, and they don't know where to identify. They don't know where to select or find those positive connections. So having the opportunity to come into a parent cafe, which is not based upon any specific group, but anyone can come. And when they come to the table, they don't know who they're sitting next to. And the whole idea is that they will develop those types of positive social connections and support in concrete times of need. That protective factor is so important. Many of our families knowing where to turn. For example, if your lights are turned off, are there resources in the community? If there are issues that you have with your child outside of school, where can you go and get those types of support? And even using the parent cafe model, sometimes parents are simply overwhelmed and they need an opportunity just to have someone to be a sounding board. And the parent cafe has become and is a type of method of support for parents in concrete support times of need. And also we have knowledge of parenting and child development. No one is born with the book to be the best parent. No one is born with the knowledge to be the best parent. Every family has different opportunities, different stressors, different positive aspects, but by being able to come to the parent cafe, parents are provided the opportunity to gain knowledge of parenting that other families may use. And sometimes parents parent the way their parent. And that doesn't mean that the way their parent was good or based upon any knowledge. So sometimes parents find out, oh, that really was not a good idea. I was raised that way and I'm using that. And when they walk away with knowledge of how to parent and child development, for example, when children may be teething, in some cultures, they use a bone to rub on the child's gum. Well, some may say, oh, that's crazy. But then when you start to realize, well, the bones have a lot of calcium, so it's soothing. So being able to share different types of things that some communities of practice may not be the same as others, but sharing, oh, I didn't realize that makes sense. Does it make sense to stir grits for an hour? Well, some people like nice, smooth grits. So being able to gain knowledge, and ultimately here, our last protective factor is communication, social and emotional competency. and particularly being able to understand how to provide positive experiences for children. I'm quite certain all of us have had the experience of seeing or even being the child in the grocery store with our parents sometimes, and parents may have said, if you don't have any money, don't put your hands on it. However, there may be some communication that we can show how we can make going to the grocery store a social and emotional competency positive experience. Oh, let's count all the cans while we're in the grocery store so that the child has a wholesome experience. But lots of things that parents sometimes experience is not because they are upset, they're angry. It's because sometimes it's their life lived experiences, and of course, we all know that exposure and experience for all is not the same. But by being able to come to the table at the Parent Cafe, it provides a wholesome, positive opportunity. You can keep it going, Quinn, to the next slide. So in our Parent Cafe Training Institute, over 30 participants from 20 organizations in Lee County, which was our targeted county. We also opened up opportunities to 2 neighboring counties, Darlington and Sumter counties, that serve families. Specifically, the target goal had to be with them serving families in rural communities. It was a 2-day experience, and the experience was highly interactive. The group leaders, they had an awesome experience, and they developed networking, and they developed collaborative efforts, and they were also able to develop some of and to share their experiences as it relates to the 5 protective factors. And the 5 protective factors and its delivery is spelled out through the parent cafes. And the parent cafe model that we are using is actually sponsored by Be Strong Families. And last but not least, you see our trained group leaders across those 3 counties. And I'm here to tell you, we have several of them. The work has continued, and we are excited. Even in Lee County, we continue to use it in our Lee County First Steps model with our parents in a program with group meetings. We also continue to use it with a program that we have that's called Strengthening Families as our booster sessions. So we want you to know that the investment that was done in this project has assured us the opportunity to empower, to strengthen our parents, to be active, and to fully utilize and engage the 5 protective factors. So of course, as has been stated, in any good garden, you've got to prep the soil. And when you prep the soil, you want to make certain that you wake up everybody. And now I'll turn it over to Ms. Quintasha Knox.
Good afternoon, everyone. I'm going to talk about the planning section. So I'm not going to go in great detail about the WIS model. Beth Berry eloquently spoke about that earlier in our introduction. So I'm just going to go through it and talk about the components that this project touched on for the WIS model. So one of the major components was the nutrition and environmental services. We actually implemented a garden with Project Care. So we had a school and community garden. In terms of employee wellness, we actually implemented a walking trail for staff and the community to use. In terms of health services, we partnered with Care South Carolina, and they actually did mobile dental services for the children in the county. In terms of counseling, psychological and social services, we actually, during the Parent Cafe, we were able to refer parents and their children to local resources and support services to help them if they needed any help with anything that was brought up during the cafe. In terms of community involvement, one of our big things was we started to let our coalition meetings be in different spaces to get other community members involved in the participation of some of the initiatives that we plan to do for the coalition. And one of the things we had, I think, at least 2 coalition meetings at the school. giving the community a chance to come and sit in on those meetings. Another one was family engagement, like Alexis just talked about, the parent cafe, and also physical education and physical activity. That was the implementation of the playground itself. So in terms of literacy, like Regina spoke about, when we first start working with this school, they had about 3 children that were reading at grade level. So of course, literacy was a big thing that we wanted to help implement strategies to help the kids get on reading level, because if they didn't pass the reading test, they would have to stay back another, they had to repeat the 3rd grade. So we didn't want that. So we created the Literacy and Wellness Alliance, and that was just to create a holistic approach to create awareness around literacy and health in the community. We partnered with AmeriCorps. They already had a AmeriCorps volunteer going to the school, and they were reading with about 5 children. And then so we wanted to kind of expand that effort since the need was so great. So we solicited volunteers. Some of the actual coalition members volunteered. We did a book drive, and Central Carolina was our major partner, and they donated over 700 books. In those books, we created literacy kits for the 2nd and 3rd graders, and I think the 1st grade also, to take home so they can start their at-home libraries to get reading a priority in the household so they could eventually pass that reading test. Also, Save the Children was a great partner. They donated books. We also work with local businesses to get reading incentive, like ice cream, things like that. Try to do a little bit more healthier options, but kids like ice cream, and if they want to read a book and get some ice cream, it is what it is. And we also try to work. We're also trying to keep this going. So this is an ongoing initiative of the coalition. So one of the things pictured here, I want to point out these 3 people because they were true champions. So the gentleman in the blue, that's Mr. Dixon. He put all the raised beds together. He was just awesome. He is an avid gardener also. And in the middle is Miss Diane Kent. She was the 3rd grade teacher at Wesley Elementary. She was awesome also. This is her class. So they were excited about gardening and growing. So they were growing beans and potatoes and all kind of stuff. And then on the left is Miss Ruby. She is a member of the coalition and the farm and garden committee. She was awesome. So she brought all the soil out there and helped the kids do all the planting. And it was just a great experience for the community to come in and help the school. So one of the big things is, in terms of nutrition, is kids need to learn how food grows, and if they know the value of food, they will probably do a whole lot better with eating their fruits and vegetables, because we harp on them about eating fruits and vegetables a lot, but sometimes you just need this hands-on experience to kind of get that appreciation about food. So this was the actual garden up at the school that was close to the school. And then out here was the community garden that you see pictured. Another notable mention would be Miss Jonette Kaufman, one of the county council members that actually lives right up the street from the school, and she heard about what we were doing, and she got one of her employees to come down and dig up all of the ground out there, because of course it was just too much to do with with us. So they got to planting beans and squash and all kind of good stuff. And pictured here also is Miss Kent's class with Miss Ruby showing me actually the potatoes that they actually grew. So they were so excited and proud about those potatoes. So it was definitely a great learning experience. So in terms of perennials, of course, we want to use evidence-based strategies to to implement in communities because they're likely to be more sustainable. So one of the things when we were initially talking about where our project was going to be, me and Regina was talking on the phone, and we kind of clicked wavelengths and came up with Wesley in terms of where we wanted to kind of focus our efforts because of the need. So probably in about 2017 is my first encounter with the school doing some nutrition education. And of course, I'm very observant when I go to a school. I want to eat what they eat. I want to do what they do, a day in the life of a student at a school. So one of the things I saw was they had no playground. And I'm like, school without a playground? And so the kids were sitting under this tree. They would just sit there and you see the basketball goal kind of leaning over to the side. And that's where they were playing basketball at. So, but majority of the kids were sitting under the tree. So I said, now this cannot be right. So one of the things too that I noticed at the school, they didn't have a gym. So where I did my nutrition education lessons was where they would have PE and they would do whatever PE activities they could do inside, and the PE teacher would take them outside. But of course, it wasn't any structured play, which is fine. But that was a big issue for me that the school just lacked that many resources. So one of the other things was they told us about some of the wants that they wanted and some of their needs. So one of the big things was the outdoor learning space that you see pictured here. So Ms. Kent really wanted a place that she can go from the garden to external classroom outside to actually um, to give the kids a change of scenery and to do their work outside. So this is one of the things that we focus on our efforts on doing because they didn't have a gym or auditorium. They didn't have anything. So of course we had the Farm and Garden Committee, which we partnered with them to do a farmer's market during the summer because that is a great multi-use space. So they would just literally just drive up around there and buy what they wanted to and kept going. So that was our awesome addition to have. And also the picnic area, it could be used as a picnic area, and they also used it for school assemblies to have things outside. And they also wanted a place to have like a mini amphitheater. So that was a multi-use space that the outdoor learning center was used for and continues to be used for. So one of the big things was our goal was to get a playground. So Joe, Bill, and myself were tasked with this particular portion of the project. So as you see here, and this is much more grand than we thought we were going to be able to afford. Trust me. But we met and we were able to talk to the right people, which I'm going to talk about a little bit later, and get in this playground for the kids. And when I tell you, they absolutely love it. Love it. So we have a open community use policy with this playground. It's ADA accessible. And one of the big things was we want to increase physical activity. Our main objective was to get those fitness gram levels under control. The girls, the kids were, I can't even remember the stats, forgive me, but the kids were out of shape. Just put it that way. They were out of shape. And the girls were way more out of shape than the boys. And if you go outside at any given time and you see that tree, all the girls are sitting under the tree, I guess trying to get shade. But that has really affected their physical health and not being able to run, play, and also being able to learn. You have to run off energy, get those brain cells moving to be able to learn. And that's one of the things that we saw in the numbers, in the data, to be honest with you. And then also worksite wellness. A lot of the teachers wanted to utilize that walking trail to walk. A lot of them didn't live in the county, so they would have to either go to the gym before they went to work or after, so that they were able to utilize the walking trail after work. And if you see here, you see the signs. It was 6 laps around the track equals a mile. We wanted to really do nudges to kind of encourage people to be healthy and just get active. Um, that was one of the things that was mentioned in the community health assessment that was done, I think, when Regina, in 2015 or 2016. But that was one of the things they wanted, was somewhere to be physically active. So we helped get that. So this is like a larger picture of the park, the Wesley Elementary Park. So it was definitely a labor of love. We worked months and months trying to get this together in countless meetings. So um, go back. So in terms of leveraging resources, um, the playground, in terms of the playground, we couldn't use the grant to purchase that equipment. But we did do, we actually worked with the county administrator, which was, he has been instrumental in working with us to get things we need for the county and the school district. So the school district basically had to lease an acre of land to the county. And then we worked with the legislative delegation to get the part funding to do the playground. And in that part funding, we had to do a match. We had to match the grant. So we had to come up with, I think,
Okay, I think Quinn is frozen and technical issues do happen. But just as Quinn was saying that we did have to do the match for the PARD funding. So that was very instrumental in helping us to gain these additional resources. So our partners included the Lee County Council, the county government, adult ed, the school district, Parks and Recreation, Lee County First Steps, the Farm and Garden Committee, as well as CARE South Carolina, Central Carolina Technical College, the United Way of Sumter, Lee, and Clarendon counties, Department of Health and Environmental Control, and the Lee County delegation. So we had numerous groups and partners in this effort in order for us to get some of the needs met of this community in Lee County.
so one of the things too, in terms of the leveraging of resources, we had to match the grant. So we ended up using some of the funding for the grant to match, and also Care South donated all the funding for the fencing. And then we worked with the county to use the other, the labor for the workers as in kind. So library partnership, one of the, and when you think about reading, one of the first things you think about is the library. And unbeknownst to us, most of the kids had never even been to the library in town. So, and this school is about 14 miles away or so from the town, from the library. So it's very rural in terms of the county. So one of the things was the principal actually scheduled, partnered with the library and scheduled field trips for the kids. Just about every week they would go to the library and they would work with Miss Brenda and Miss Deanna, and they just loved it. That's them sitting there, and Miss Brenda's back there making snacks. So they they could read, they could get books, and they were eating snacks the whole time. So they were, it was just awesome. They also got signed up for library cards, and they were able to sign up for summer reading. They kind of kept that going. So that's been awesome that they've been able to do that. One of the other community clinical linkages that we worked on, Regina and myself, did an oral health presentation about the importance of oral health. So the kids, that county is not a lot of, like Regina says, a lot of food insecurity. So a lot of times they know soda, and juice, but they didn't know water. So of course that affects your oral health. And they were just really excited about all the things Regina was showing them, how to brush their teeth. And she actually gave them kits to take home. And I worked with them on showing them how much sugar was in the drinks that they were drinking. So that was a great partnership. And also, this is CareSouth's dental van, mobile dental center, that they were able to get on and get their cleanings and other dental needs that they had. So Regina talked about the a little bit about the English and language arts, right? So during the 2017 and 2018 school period, it was 9% of the kids were on track to pass that third grade reading test. And in terms of their physical well-being, it was at 31.8% that the kids were. After the project period, it went up from 9 to 19.2%, which is awesome. And then from 31.8% to 61.9%. So they saw a huge jump. And I think a lot of it was due to awareness. And then a lot of it was also due to the intervention that we implemented because it was so needed. In terms of the core partnerships, Lee County Council was a great partner, Lee County government, adult education, the school district, Parks and Recreation, First Steps, the Farm and Garden Committee, Care South Carolina, Save the Children, Central Carolina Technical College, South Carolina Office of Rural Health, the United Way of Sumter, Lee and Clarendon, South Carolina Department of Health and Environmental Control, and the Lee County Legislative Delegation, which includes Senator Jerry Malloy, Senator Thomas McLevine, and Representative Will Wheeler. And this is most of the folks that worked on the project. We were excited to be able to work in a community, and it was received so well, and we can see the impact that it has made in the community. So we thank you so much for listening, and we're going to open up the floor for questions.
Thanks to all three of you for a good presentation and also some good knowledge on how to move forward. A couple of questions have come through, and I think we do have time for at least one. One is in regard to responding to the COVID pivot with the new challenges and requiring priorities to be refocused, and partners and community members. How have you found to engage them in new ways to sustain these projects?
Is that anybody or what?
Yep.
Well, I think Zoom has been a masterpiece, and as Regina was previously our chairperson of our Interagency Council and the collaboration with the RLI, which I was chair, but ultimately Zoom has made sure our community has continued to be engaged with meeting as well. So I think that has been a pivotal piece of being able to be resilient with what's accessible and what's been available. Even as a part of this, and Regina, you may want to ask a little bit more on the census, trying to make sure that we got out the residents to vote for in terms of them participating in the census.
Yes, as Alexis said, that it was essential for us to continue the work that we were doing during COVID, and to be able to sustain that. Of course, we had to put together our plan, and we had to implement our plan, and we used resources such as Zoom. As he was stating, the census was being implemented. We were trying to make sure that people were represented and counted in Lee County. So we had a lot of challenges that we faced during that time of the census. So we as a coalition had to strategically place ourselves and align ourselves to make sure that we address a lot of the community health issues. Food insecurity was one that was exacerbated during the COVID-19 pandemic. So we had to leverage our resources, get people involved, churches. A lot of our organizations stepped up to the front, but our coalition definitely was in that leadership position where we were able to address a lot of the community needs and issues during COVID.
There was one more question that you did answer it to some degree when you were speaking of your partnerships, but if you have anything else to add about working with schools and school districts being a challenge oftentimes, but any tips on how you were able to be successful?
I think, go ahead, Quinn.
And we're probably going to say the same thing because that's just how we work a lot of times. But I think too, historically in rural South Carolina and rural areas, the biggest issue too is building relationships. And I think a lot of people miss that. It's been a lot of helicopter programming. Things start, they stop, they start, they stop. So communities a lot of times will not trust people coming in the community saying that they're going to do something. So originally when Regina and I met with the superintendent, and then Joe and I met with the superintendent, I don't think she really believed that we were going to do what we say we're going to do. And all three of us are people who won't take no for an answer. So I think that was the key to it, was that we built trust with the school district. And then we also became a conduit for the school district and the county to work together and to get this job done. And so I think that's the biggest thing, is trust and being a person of your word and really caring about people. And that just illuminates when people know that, you know what I'm saying, you're just not out here just talking a good game about what you're going to do. So I think in part is trust, building trust, like genuinely building trust.
Well, thank you to all three of you. And this is Meg Stanley again from Eat Smart Be More. Thanks for all of you who participated in this session. If you have additional questions for our presenters, their contact information is on the screen right now.